evening, everybody, and welcome to the Health and Adult Social Care Overview and Scrutiny Committee, the 6th of March 2023. I'd like to ask Louise Smith to read out our housekeeping notice.
Thank you, Chair. Please note that this meeting is being broadcast by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. Please could everyone present follow these ground rules. Only speak to when invited by the Chair. For those present in the room, please use the microphones on your desk when speaking. If accessing the meeting via Microsoft Teams, please turn on your video function before speaking. Again, if you're accessing via Teams and would like to speak on an item, please do so by utilizing the raise a hand feature bar in the top of the Teams window. For those in the room, please note if a fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point outside the front of the annex building. And finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you.
Thank you, Louise. Have we got any apologies for this meeting and any substitute members?
Apologies have been received from Councillor Dion and there are no substitute members.
Thank you. Do we have any declarations of interest? Councillor Johnson.
Thank you. I'd just like to declare that I'm employed as a staff nurse at Royal Bournemouth Hospital.
Councillor Evans.
Thank you. Just for transparency, I'd like to declare that I'm a bank employee of University Hospitals Dorset.
Thank you. We can move on to confirmation of the minutes. Has anyone got any questions or do we agree to confirm the minutes held on the 26th of September?
28th of November. Oh,
sorry, 28th of November. Do we all agree on the minutes?
Yeah.
Thank you. The action sheet, which is agenda 4A. Have we got any comments on the action sheet? The Butler.
Yeah. Yes, last time I asked about younger people and children in regard to the vaccine, and I haven't had an answer on that yet.
Would anybody like to comment on that, or are we going to take it back to an officer?
Sorry, apologies, Councillor Butler. We'll need to refer that to Children's Services and to understand from them if they've got any access to that, or possibly Sam Crow, but I'm not sure that we've got direct access to that information at the moment. So apologies for not coming back to you before now.
Thank you.
Okay, moving on. Louise, have we got any public issues for this meeting?
Yes, Chair. We've received the following questions relating to Agenda Item 8, Day Opportunities Strategy, Case for Change, from Amanda Pearson's People's First Forum. Question 1. Regarding point 64, Option 3, Mixed Model of Day Opportunities, please can we have reassurances re the continuation of services until the details of the proposals have been consulted on? The answer being provided is services will continue as they are today, but officers will work with Tricuro to ensure people's needs continue to be met, whilst further work with the project groups, including the co-production group on the next stage of the project in regard to service design and modelling, will happen subject to Cabinet approval of the Case for Change report. Any specific decision about a service change would involve consultation with stakeholders of that service and will include independent advocacy and equality impact assessments. Question. Regarding point 32, you say there has been a negligible travel implication, but how have you looked at the other possible implications? For example, what checks have you undertaken to ensure us that the needs of people with profound and multiple learning disabilities who are now at Parkstone Connect rather than Wallace Down Plus are being met? Can you confirm that they are having a good service that includes freedom to roam, regular access to meaningful building-based activities and regular meaningful community-based activities? The answer provided is between August 22 and November 22, Tricuro organised an engagement exercise where individuals, carers and family members were asked for their feedback and ideas regarding the services they receive. This has been shared with the project groups and was largely positive about services, with a significant number wanting more community access. The wider BCP view seeking exercise in October and November also received a number of comments about services, including Wallace Down Plus. Although there was a lot of positive comments, there were some concerns raised about the lack of physical space and access to the community. In addition, during 2022, the Learning Disability team have observed areas of good practice were observed, but had some recommendations to further development the support provided. The next stage of the project will review all of this information in order to co-produce, co-design and remodel services to ensure that people's needs are met through their service provision. Thank you.
Thank you, Louise. Agenda item 6, which is the preparation for the CQC assurance. If I can ask Betty Botlin and invite Chris Mackenzie, Interim CQC Preparation Lead, to present this report.
Thank you, Chair. I'm going to pass over to my colleague, Chris, to introduce the report.
Thank you, Betty, and good afternoon, Chris Mackenzie. Can everybody hear me okay? Yeah, great. So I joined BCP Council at the start of January as the interim CQC preparation lead. So I'm here really to support the council in getting ready for CQC assurance visits. What I won't do is go through all of the paper in detail. I know members of the committee received a report back in September last year setting out the likely approach that CQC would be taking towards their assurance. I just wanted to say that since that presentation back in September last year, obviously I know some of you may have attended the all-member briefing that we just held prior to the overview and scrutiny meeting. But just to say that the CQC have now published their framework for assurance, which is available on their website, and that sets out the arrangements that they intend to take in terms of discharging the responsibilities that they have from the beginning of April. So just to summarise that, from April, the Care Quality Commission will have the power and the duty to undertake inspections of local authority arrangements under adult social care. So particularly our responsibilities under Part 1 of the Care Act. But I won't spend a lot of time going through that, as I know members have already received information on the proposed approach in a previous meeting. What I thought I would do is just summarise some of the work that we've done to date and the plans that we've got coming up, and then particularly focus on some of the key priorities that we've already identified through the work that we've done to date, which is set out in the report. So in terms of our preparations to date, we've done an awful lot of work to gather a range of different intelligence and evidence. And in my time here, I've spent a lot of time talking to colleagues and seeking to understand where we are against the CQC's framework. We've started to develop and complete our self-assessment, which will really help us to understand where we are. And I do think with things like CQC assurance, as much as anything, they're about understanding and testing us on our self-awareness. Do we really understand where our strengths and areas of development are, and do we know what we need to do to improve? So we're really focusing in on that and looking to understand how well we know and understand ourselves. In paragraph 15 of the report, I've set out the timeline of next steps that we intend to undertake over the course of the next few months. Quite a bit of that is building up to hopefully something that will take place in June, although we're just confirming the dates with the Local Government Association. But at that point, we intend to have a Local Government Association peer review, which will be a real opportunity to test our progress and preparations to date, and to really look at how well placed we are to respond to a CQC assurance visit. And so we see that as a really important milestone, and we're doing a lot of work at the moment to prepare for that and get ourselves ready for that local government association peer review. And so the paper sets out the things that we're doing to prepare for that and to get ready for that. And obviously, we would report the outcome of that peer review to the Overview and Scrutiny Committee following that date. And then if I can draw your attention particularly to paragraphs 16 to 25 of the report, which set out some key priorities that we've identified based on our work to date. So as I say earlier in the report, we have started to pull together a self-assessment, and through that work and in discussion with the Directorate Management team, we've identified some areas where we know that we need to do some further work to get ourselves into best possible position and ready for that CQC assurance visit. So some of the areas that we know we need to focus on particularly is around ensuring that we've got a really clear narrative of our overall plans for transformation and improvement of services. So rather than having lots of separate plans, ensuring that we've got a really clear narrative and a clear plan that sets out what we need to do and how we're going to get there. So in paragraphs 19 and 20, that sets out some of the arrangements that we'll need to make there. Members of the committee will know that we've recently completed work to move on to a single case management system. So that's onto Mosaic, which is now the only care management system that we use within adult services. What that work has meant, though, is that we need to do further work to ensure that we've got really clear sight of a comprehensive set of performance data and intelligence that ensures that we've got a good understanding of the performance of our services, and that is again something that we've identified as a priority. And as well as that, we also need to strengthen and ensure that we've got really robust governance arrangements in place to manage performance within the directorate, and that is going to be another area of focus which we've already started work on. One of the things that we need to do to ensure that we've got a really good understanding of ourselves is ensure that we've got good quality assurance information and intelligence. And so from next month, we'll be starting arrangements for practice learning reviews within the directorate, which will supplement some of the existing quality assurance arrangements that we already have in place. And then we've also been looking at some of the nationally published data to help us to understand how we perform against other local authorities, because that will be one of the key things that CQC look at before they come in to visit local authorities. And what we know from looking at that data is that the council's use of direct payments is not as high as many other authorities in the country. And that could indicate to CQC that people who draw on support and carers don't have the same access to personalised support that other areas could have. So that's an area that we do need to focus on. We also know that the national data says that shows that we spend less per head of population on short-term services to maximise independence than other councils, although our spend on long-term services per head of population is slightly higher than the England and regional averages. So again, that's an area that we need to look at, but it's important that we look at that in conjunction with other partners, for example, health, public health, to ensure that we're joining up our efforts to deliver preventative support to individuals as well. So that's really all I wanted to say in relation to the report, but I'm happy to take any questions on the arrangements and the work that we're doing to prepare for CQC assurance.
Members, anybody got any questions? Councillor Butler.
Thank you, Chair. Yeah, I'd like to ask Chris about supervision and training of staff. Is there a set provision for that, a regular, every 6 months or every year for supervision?
I'm sure Betty will want to come in on this, but just to say, from the perspective of understanding how well how strong our arrangements are, the quality of supervision is undoubtedly something that we need to provide assurance on, and that CQC will look at. But if I could let Betty come in on the actual arrangements to provide supervision.
Yeah, thank you. So we do have supervision policy in place, which has supervision requirements within it around when supervision should be expected and what is the distance between one supervision to the next supervision. And what we constantly are doing is reviewing that to ensure that it is moving at the same pace as maybe our staff training and our, the level of casework changing, more complexity. But what I would say is through this process, we have really focused on standards. So therefore really looking at what are our supervision standards, Do we want to have supervision contracts in place, which is best practice? We do have those in place, but do we need to be more robust and make sure that they're in place with every member of staff? So there is a policy, there is a requirement, a timeline set, and it's a two-way process and all of that kind of stuff, and it's documented and actions recorded. But I think for me, and I'm sure anyone would say this within adult social care, particularly for practitioners such as social workers and occupational therapists, it's really important that supervision is robust and that people are able to talk about casework and are able to feel that they're doing that with someone who really understands and is able to give that support. So there's always room for improvement within those areas. But this process has, encouraged us to really review that. We do undertake supervision audits where we will look at, is the policy being implemented? How is supervision for the people that are having it? So yeah, that's something that's really high on our agenda for our staff well-being, as well as trying to, gauge our level of complexities within casework and making sure that staff feel capable and competent to deliver those.
Thank you.
Councillor Dedman, do you have a question?
Yes, thank you, Chairman. It's not exactly a question so much as a comment. I'm really appreciative of all the work that everybody's been doing. I know it must have been really, really hard work and added onto everything that you do anyway. I'm concerned, it's item 5 on the report that we've got, the Making It Real framework, which, do I understand it that the Care Quality Commission are putting that in place? It's not our thing, it's their thing.
No, they're not. The Care Quality Commission are not putting that in place. An organisation, a national organisation called Think Local Act Personal, developed the Making It Real framework, and it's been co-designed by people who draw on support nationally. So it's intended to capture the voices of people who experience social care and who draw on social care, and setting out what they need and want from an effective adult social care system. What the Care Quality Commission are doing is using that nationally produced framework by Think Local Act Personal to inform the development of their own framework. So the intention of that is to ensure that when they're assessing the effectiveness of arrangements, they're also assessing them against what people who draw on support have said is important to them.
Right, well, Chairman, can I just say that my comment was that I've had experience of a lot of these sort of things, and in my view, a lot of them are very subjective, and people say, make statements about what they want when some of these things are impossible to comply with. So I think that's what I wanted to get over, that I think it's quite dangerous to rely on a lot of those things. Surely we should be supplying what people need rather than what they say they want. But anyway, I'll leave it there. Thank you.
Councillor Matthews, did you have a question?
Thanks, Chair. Yeah, thanks for the presentation. And like Councillor Dedman said, I'd echo all the hard work that's gone into this, because clearly there's a lot of preparation and so on. So as I understand it, this new model kicks in from April. Do we have any idea of how much warning would be given in terms of practicalities from if an inspection was due to take place? That's my first question. The second point I was going to ask is, I've realised this is a brand new framework and model, but has this been trialled elsewhere, which is something that we could get data from and some backgrounds? And the other point as well, and I guess this kind of links with my first point, if they did turn up in April, our peer review is going to be in June, so there's a bit of a kind of, and I know I appreciate that that's just the way it probably is and stuff. But so yeah, no, those are most of my points, but I think the work that's gone into this is great. Thank you.
So if I could come back on those points, is that okay? Just to say, in terms of has it been trialled elsewhere? Yes, it has. There have been 2 trial assurance visits so far, one in Manchester, one in Hampshire, which they've used to help inform the development of the framework. And it's important to say that whilst CQC will have the powers from April, they have set out that between April and September, they intend to do further tests of the framework on up to 5 local authorities. And the latest intelligence we have is that they are looking for volunteer authorities to come forward to be one of
Sorry,
those
you're
5.
breaking up a little bit.
Sorry.
Sorry, you're just breaking up a little bit there, Chris.
Okay, apologies for that. Can you hear me okay now? Can you hear me?
No, we can't hear. No, sorry.
Let me try again.
Could you turn your camera off
I'll
and
turn
see
my
if that
camera off.
helps?
Can you hear me now? Can you hear me now?
Just about. It's very faint.
I can
Okay.
pick it up.
Betty, do you want to pick it up
I
then?
can
Sorry.
pick up some points. Yeah. I can hear you fine there.
Can you? Am I back?
Yeah.
Can you hear me now?
Yeah.
Can you hear me?
Mm-hmm.
Yeah, okay. What I was saying is that there have already been 2 tests that have been undertaken, and there are plans to undertake 5 further tests between April and September. And at the same time, the Care Quality Commission will also be gathering and looking at national data and evidence to build a picture of the whole sector, as well as those tests that they undertake.
I'm going to take over.
Okay,
Chair,
thank
that's
you.
okay.
Yeah, sorry,
Okay,
Chris.
apologies. Yeah, no, that's fine.
Thank you, though. As Chris said, from April to September, we know that there's going to be 5 areas that they're asking. We believe that the Care Quality Commission will ask for councils to volunteer themselves. We touched on that earlier. And then there will be various others right through to the end of the year, 20, and then another set of 20 visits that will take place. With regard to the second part of your question, which I think was around the timescales, it's difficult, as we touched on earlier as well, because we haven't had CQC come in and inspect adult social care for some time. But we don't know until they've done their first 1 or 2. But what we do know is that through what they have shared with us, that those that they will have assessed during the period up, they would hope to publish findings in February. You know, for those groups, they've broken them down into 3 kind of areas. And I guess for us now, like I said earlier, it's all about preparation. So we could be as early as the first kind of stage. We could be in the middle. We could be at the end. We really have got no way of actually knowing. They will notify us, and they will give us, they will give us time through the notification, because they will request a lot of information that they will need to study and read. But as Chris said, they will have some national data that all local authorities have to provide on a yearly basis. They will have that, and they will have done their kind of analytical work around that, around where we are compared to the Southwest partners and national partners. Are we different? Are we not? And they will, we're trying to be really transparent with ourselves and identify the areas ourselves that we think we might need to kind of put some more focus on and have a plan. Chris alluded to 1 or 2 of those areas, in his kind of presentation to you just now through the report. And that's what we're doing. But like we said earlier, we need the support of members and everyone, because, this is very similar, if not the same, as Ofsted for children. This is it for adults, and I would really stress that.
Can I ask Phil Holsby to come in there, please?
Just, Chris, just if we think about the experience of children's services, it's likely to be on a similar time frame, which should be about 10 working days notice before we have to produce all of the information, which is why we want to have the information prepared in advance, not wait until the call. We'll just have to keep refreshing that information as time goes by. So it doesn't feel like a long time, but the whole idea is that you know yourselves before, whether they came tomorrow or a month's time or 6 months' time. So I think the key is preparation, as both Chris and Betty have said.
Thank you. Councillor Robson, I believe you have a question.
Thanks, Chair. No, it was answered by Betty and Chris. Thank you.
Okay, thank you. Can I just ask, I mean, it's probably something you probably can't answer, but you were saying earlier that you'd been going over and perhaps looking at maybe there were gaps that you had and everything. Now, we all know there's a real problem with adult social care staffing. Now, is that something they're going to take into account if we have a problem with it here? Because it's not just us, it's just about every council in the country have this problem. So when they know there's a national problem, will they, do you know, take that into account when they do your review?
Yeah, so I'll pick that up, Chris. If you need to, maybe just see if you can chip in and see if it works. What we do know, Chair, is that CQC will be very, very aware and up to date on what are the national challenges that are facing adult social care areas. So they will know around workforce, and they will know, you know, we know that several of our challenges nationally as well, and we will need to put that into that context. This will not be specific to us in BCP, but it will be impacting on us within BCP, will be around the challenges at times in recruiting occupational therapists or social workers. It will also be around, Phil might want to come in, around the care market and how we really make that you know, a kind of area where people want to work and stay, and how are we doing that collectively with health partners and other, you know, the independent and voluntary sector. So they will be very well sighted on all of those challenges because they are not unique to BCP Council and our adult social care team just here.
Thank you, Betty. Did you want to come in, Joe?
Only just to reference that later on the agenda, we're obviously giving an update on the fair cost of care exercises and the market sustainability plan, which does talk a little bit about addressing how commissioning is looking at how we, and one of the priorities within that is around, well, partly about how we ensure we've got services that are around supporting people to be as independent as possible, therefore reducing the reliance on long-term care as a major factor as part of that market sustainability plan, but also then what work we're doing with the workforce around recruitment, skills development and things like, and reviewing what we can around the fees we pay and where we and how we'll use the market sustainability plan to try and help resolve some of the capacity issues we have with the workforce at the moment. So we'll be coming back to that a bit later.
Thank you. Anybody else got any questions? Councillor Johnson.
Thank you. It might be inappropriate, but I wanted to ask Betty, do you have a feel for what sort of things that we're likely to fail on, or, you know, we're likely to fall down on, can recommend to help us with?
So I would just reinforce that what we presented earlier and what I've touched on, the areas where our gaps are, but that's not to say that we will fail in those areas. And I would not like to try to preempt or wish to preempt any of those our outcome. So what I would kind of turn that around to kind of maybe put back is that we are being very transparent. We're being very objective with ourselves. We have put ourselves forward for a bespoke safeguarding review, which I said earlier started today. I've been in the other room over there where that's going on. That will give us some indication of where we are in that particular area. We have put ourselves forward, like many other councils have to, for a local government peer review, for the Local Government Association for a peer review. We're hoping to have that in June. We haven't finalised that completely yet, so I would just stress that we need to sign on the dotted line and just get the formalities concluded with that. So I guess I wouldn't want to gauge where are our current areas that we may fail in, because I think if we prepare and we are very self-aware, we can start to bring about positive change in those areas. But I would also not wish to downplay how serious and how much work, as you've said, is going to be involved in this, alongside doing a very busy day-to-day work requirements for all of our officers.
Thank you.
Councillor Devlin, did you have a question?
Well, I just wanted to come back on that. I don't know, I think people here know I used to have a care home, and I used to be in the firing line. No, that's not quite what I mean. In the front line of the inspections, and I know this is different because this is a massive organisation, but my view was always that they're always very helpful. They want to be helpful. They don't come in. I think you've been talking about Ofsted, and I think we may all have a coloured, we haven't done terribly well maybe. With this, I think that, I think it says here that there may be, they're developing the baseline before this goes not live. And I think that that needs to be taken into consideration, both with the committee and the staffing, that they will take into consideration all the national problems, which are huge in most of these areas, as we all know, but also they will be taking into consideration all the work that we 3 towns have done. And I know Christchurch was really Dorset, but that's, it's another story. I think that will be taken into consideration. I hope very much it will. I'm sure it will. And I think that needs to be considered when we all go through this. I mean, luckily I shan't be in the front line in this. You all will. So, no, I think that there will be initially a need to structure what they consider for this council and all the other councils, and then there will be the ability to put this framework into position, and then we measure ourselves up, and I'm sure we will come out well.
No, I think just to go back on that as well and acknowledge what you've said, I think it's about how we present our narrative as well, which will involve all of the stuff that you've just said, the national challenges, but also, we are a relatively new, much bigger council, and that in itself is massive. So it's about how we present that narrative and bring that all in at a very early stage as well, and how we share that with our colleagues that will come from CQC.
Thank you. Can I just ask if will some of this work be any preparation that you'd already been made, and now the government have put the social care cap back, but would you be expected to have said that you'd started to prepare for that at all, or is that a completely different sort of item really?
It is a separate item, but what they have said is that we can use some of the funding we got that was to implement those reforms to help us in our preparation for and thinking about how we support the market and ourselves to be able to respond to the challenges of social care at the moment. I think the key to this is, and part of the reason we've brought Chris in, is to have some objective view of our world rather than us marking our own homework, and that's really helpful. And Chris comes with a lot of experience and knowledge, and it's helping us just know which areas we want to set out an improvement plan before, regardless of whether CQC came to us or not. This has given us an opportunity for some self-reflection, and I think that. And if you know yourself and know the areas that you need to improve, and you've got a plan about where you might lift yourselves even higher than you are at the moment, CQC will look favourably on that and say you're self-aware and you can see the journey you need to go on. Where they get really irksome, and the same for Ofsted, if you looked at them, is when you're in denial about what you need to do. So I think we're being, as Becky said, really transparent about where we are. And I think the other point I wanted to make is this committee has a key role to play in terms of how you were cited on the work we're doing and the journey we're on our performance. And probably for next year's work plan, we need to think about how often we're going to look at adult social care performance in the context of a wider system as well, and also bring our health colleagues into the room to say, and how is the ICS performed?
Thank you, Phil. Actually, I was going to ask about how this committee could have some input in what was happening with this. And Councillor Butler.
Thank you, Chair. Your single case management system, the Mosaic system, does that mean that all professionals can tap into that for each person needing care? Is it something that can be shared, or is it just specific for one element of the service?
So as members will know, we have moved to a single system that recently became live, very recently. So we are still working our way through some of the kind of issues that we knew would present with a massive new transition over to a new system with so much migration of information needing to take place. I think we with all systems, IT systems, we need to be really mindful of confidentiality and a need to know basis for information and who has access to what information. So I would just want to put that there first. What it does do is it aligns us to one system within children's and adults. So within the council, we are now aligned to the same systems within our children's services and our adult services, and it also aligns us within adult care more collectively. You know, we referred to when we reorganised, when the council reorganised into BCP, our Dorset colleagues then at the time that came over into BCP were on the Mosaic system, which is the system that we're all on now. So we're our Bournemouth adult social care teams, but our pool team wasn't. So it was really important to do that anyway, to bring everybody together, because practitioners should be able to go around and use one system and not have to work off two systems. So that's been something that's been in the planning for a considerable amount of time, because these things take a lot of planning. So we're delighted that we've all moved over to one system. We just reinforce we always need to be really mindful of data sharing of information, but that seems to be much more fruitful in the consistency for our residents and for our staff is really important.
Thank you.
Thank you. I think we can only recommend at this stage, because obviously there's elections in May. So when the next meeting of this committee meets in June, we don't know who's going to be on it or who's going to be here. But I think as a recommendation, we would ask that this goes on to a forward plan, and certainly after the peer review. And I think, yes, yeah, I think I have agreement there. So thank you. So if we thank you for that, and thank you, Chris. If we can move on to agenda item 7, which is the liberty protection safeguards. Can I ask Sarah Webb to present this report, please?
Yes, thank you very much. Good evening, members. I do have a presentation that I can just share on the screen just to help us through the briefing report. So just to introduce myself, my name is, just try and focus on getting the screen shared first, sorry. No, that's better. Sorry, Apologies, technical difficulties. So good evening again. My name's Sarah Webb. I'm Head of Statutory Services in Adult Social Care Services. So this evening I wanted to just provide you with an update of how, so that you're fully sighted on the work that's being undertaken by Adult Social Care Services in the implementation of the Liberty Protection Safeguards. That's LPS, which is less of a mouthful for me to refer to. So if I can just move through to the first slide. So I'm hoping that most of you will have an awareness of what LPS means and its background. Within the slides which I've shared with Louise, so I hope that they can be shared with members after this evening. There's a link to a short video that was provided to me, which is very informative video that gives you more information about where LPS has come from and what its impacts will be for our residents in the BCP area. Just to give you some brief information, the Mental Capacity Act was recently amended, and LPS comes out of that amendment, and it will affect people that perhaps lack capacity to make decisions about their care and treatment. And so LPS seeks to maximise the person's involvement and very much to respect the person's wishes, and it aims to minimise the impact of any necessary deprivation. Sometimes to keep people safe and provide good quality care, it is necessary perhaps to have some restrictions, limitations to their liberty, which they may not be completely happy with, but does perhaps improve the quality of their life. Okay. So just to give you a little bit more information around the current position for LPS, unsurprisingly, the impact of COVID on central government has had quite a big impact and delayed the code of practice, the regulations and the impact assessment that's associated with LPS.
Sorry, Sarah. Do you just want to put it on the slideshow function, just so that it will make it bigger on the screen? That's it.
Better?
Thank you.
Okay, apologies. Okay, so at the moment, we've not long, it doesn't feel that long ago, finished a 16-week consultation. So we did have the draft documents come out 17th of March last year. It doesn't feel like a year ago. And BCP spent a long time reading very thick documents to get a clear understanding of what the draft documents were saying. Locally, and the national consensus was that there were a lot of elements of the draft documents that needed quite significant change to be workable and affordable for responsible bodies. So local authority, I will go into what responsible body means in a moment. So the position that we're in at the moment is that we're still waiting for final documents. Periodically, we hear little snippets of information that gives us some updates of when we might receive it. I think the last update was that we may receive that in winter 2023, which from my perspective could mean any minute now. But I have also begun to hear some rumblings that perhaps it's going to be further delayed, and that there's, I think, some reprioritisation of what we're going to be expected to do. So just to go through some of the key changes that LPS will bring, so the implications for the council. I mentioned the responsible body role. Previously, under deprivation of liberty safeguards, you would have perhaps been aware of a supervisory body role, which was really just local authorities. So that's changing to responsible body, and it's being broadened to include local authority and health organisations. So any organisation that is responsible for funding care or treatment. So the scope is broadening as well, not just from that role's perspective, but also from the point of view of it will apply in any setting. So currently DOLS just applies in residential care settings and in hospitals. But in the future, LPS will apply in any setting. So that could be a person's home, in a supported accommodation, and all forms of hospitals, etc. And it will also apply to 16 and 17-year-olds. So that wasn't the case previously. DOLS would apply to 18 and above. And obviously that broadening of scope will have quite an impact in the increase in demand of individuals that would or might be subject to LPS or need to be considered for that. One possible balancing element in terms of a change is that the renewals for LPS can be done for up to 3 years. In some cases that may need to be done more frequently, but the hope is that that's one of the elements that will reduce bureaucracy, which is part of the purpose of the changes. Just to give you a little bit more information around the impact for BCP, the LPS hopes to enshrine good practice in our routine case management. So it being included within that process rather than it being a standalone set of assessments. And that would apply for people aged 16 plus. So obviously that has some implications for our colleagues in children's social care as well as adult services. I've already mentioned that the widening of the scope will cause an increase in the number of people needing the service, which could have an impact on our resources. There is also an element that I know myself and Betty are keeping a very close eye on, because at present part of the assessment process for liberty protection safeguards is a mental capacity assessment. And at present, the code of practice, the draft code of practice, states that that mental capacity assessment can only be done by a registered professional. That will have quite an impact, because at the moment that assessment is done by a whole range of practitioners, those that are not registered, as well as registered staff like social workers. So that could well require additional resource or consideration of how we use our workforce. The other issue around an increase in demand of other services, there's going to be quite a significant impact for advocacy resources, because the broadening of scope will mean that there'll be a larger number of referrals for those services. I wanted to just explain a little bit about the preparation that adult social care are undertaking. I'm the Senior Responsible Officer for implementation of LPS, so we have a programme management. We have a joint project plan with children's social care, and we have a dedicated project manager working alongside both adults and children's social care. We have pulled together a very thorough plan, and the tasks that are associated with that plan, although we don't have a finalised set of documents, so the code of practice, etc., there are quite a few elements that we are fairly certain of, for example, training requirements, and those that we're not so sure of, based on the information that we have, we can make reasonable best guesses of what tasks will be needed. So we're trying to work towards getting as much done as we possibly can before the final documents come out, so that we're ahead of the game as much as we can be. I chair and host Pan Dorset Responsible Body Group, so that's all of the local organisations in Dorset who will be responsible bodies come together, and that allows for some very collaborative working, some good debating, good ideas being generated, and where we can work together across Pan Dorset, we're endeavouring to do so. Another very positive opportunity that we had in BCP is that we host the Southwest Region's LPS, Local Government Regional Implementation Support Officer. I just refer to my notes to make sure that I get this correct. There was some funding that came from Department of Health and Social Care, and there's a national programme of implementation to support local authorities. And there was also some funding directed at health authorities as well. And part of that programme, the Association of Adult Social Care, ADAS, and the Local Government Association contracted to provide regional support to councils and to help implement LPS. So this post that I mentioned, the funding came through, and we were very fortunate to host that. And it gives us a great deal of insight into what other local authorities are doing. So again, generation of good ideas, and gives us a little bit more access to information a little bit quicker, which is really, really positive. So I think that is me. I will try and stop sharing my screen and open to questions, members.
Councillor Phillips, have you got a question?
It's hard to word my question, but I think you'll understand where I'm coming from. Widening of the scope, many resources being pulled together, and also different services and responsible bodies. Is there going to be pitfalls and people not picking up? Is there going to be that continuity of a straight line, or will there be gaps in funding, and will there be a lot of energy and time spent sorting out those kind of issues? But there's more to the question, but I think if I start there, maybe you can broaden on where you think I'm coming from. Thank you.
Okay, yes, thank you. I think the broadening of the scope means that we have to be thinking about how we work with people who may lack capacity to make decisions about their care and treatment from the beginning, and being very, very clear about their ability to be involved in decision making. I mentioned earlier that the LPS will become part of our case management process. So it is a little bit difficult to predict the full impact until we know the details. So, but by stopping doing a set of 3 assessments for dolls, that is in addition to all of the case management assessments that we would currently do anyway, that I would anticipate allow us to make sure that the person is brought along very smoothly, that they don't end up having to go through lots of different assessments rather than just going through one process, which with deprivation of liberty safeguards at the moment, they have to go through more assessments. I think once we have gathered information once, so for example, if we understand what a person's diagnosis is, we won't have to necessarily assess that again, whereas with dolls, sometimes we do. So it's much more pragmatic, much less bureaucratic, which will allow us to give attention to detail to their journey and getting the right care that they need.
So they will only have one port of call. The client, what do we call the person, the resident, the person? Yes, one port of call for them, and then the various groups and associations will then be working together and dealing with it as a group.
That would be my aim. Yes.
Thank you.
Councillor Dedman, a question.
Yes, thank you. My question would have been then, I understood that there will be less assessments, but that would be my concern because I know bureaucracy can be a nightmare, and I know a lot of this is emergency work. But I've always felt, I mean, this is a really, really serious situation for the person concerned and for the person concerned's family. And I'm just very wary about the safety when the situation changes. You know, I mean, there's also a little bit in here, oh God, I won't be able to find it now, will I? About, naturally enough, the nursing home side of it, the role of care homes. The responsible body can delegate the assessment to the care home. Well, they couldn't before, could they, if I understood it rightly? I don't think they could. I'm just concerned about, you can give me a view, obviously, about whether this is going to maximise the safety rather than minimise it, minimise the bureaucracy, but is the safety still going to be there?
I think that the safety will still be there. I think that what this will allow is a reduction in repetition. So if, as a social worker, I was speaking to a person or their family and they needed perhaps to receive care that was restrictive and they lack capacity to make those decisions, through the assessment and the conversations and discussing with other people involved in their care, so that may be a care home environment, their information would contribute to the final assessment and decision about whether it's proportionate for that person to remain in an environment that is depriving them. So that process will happen as part of routine practice. Whereas at the moment, DOLS is a separate process that happens after those decisions have already been made. And there will be quality assurance processes that make sure that those assessments and the pieces of work and the interventions that we undertake are of good quality and proportionate.
Okay. Councillor Evans, have you got a question?
Yes, thank you, Chair. I think it's so important this work is finally, hopefully, going to come to some sort of conclusion because, as you mentioned in the report, the DOLS was not fit for purpose, which is really unfortunate for our residents who we've been depriving of liberty rather than protecting their liberty. So the sooner this does come to fruition, the better, really. However, I am concerned about the additional burden it's going to place on our social workers, the additional training that's going to be needed when we're already incredibly short-staffed. And I just wondered if you could say a bit about that, please.
I share your concerns, and I know that Betty and I've had many conversations about it as well. I think that that issue was something that we flagged in our response to the consultation. I am hopeful that there are parts of the code of practice that infer that other practitioners may be able to undertake the capacity assessments, for example. They're very, very skilled, but non-registered professionals with oversight and support of a registered professional. So I think we just need for that to be met very, very clear, so that we can take account of any extra resources that are going to be needed, and also, very importantly, make sure that our practice is lawful. We need to watch this space a little bit to see the response that we'll get.
So is this another workload that has been placed on you without appropriate funding, or has the government actually coughed up some funding for you?
Would you like them in there? Sure. Yeah. So we don't actually know what funding, if any, we're going to get. So we don't know that. We just don't know. Just reinforcing what Sarah has said, we have all commented. Councils have commented on the draft code. We did that. We're waiting to to hear what's the final going to look like, the code going to look like. From that, we will be able to gauge some of the points that we will have the clarity on some of the points. You know, we're hoping that they will have taken all of the comments into account that all of the local authorities put forward. And as Sarah mentioned, in the southwest, we have our lead, who is the conduit into BCP, adult social care. I take a keen interest and have a role within the Southwest Directors Group for LPS as well. So we have done as much as what we can do now until we wait the final outcome, really, because that will tell us what is actually going to be expected, who's actually going to be able to undertake the assessments, and then we'll be able to project and kind of do some real tangible predictions around what that might look like based on our trends and our population.
Thank you, Betty. Councillor Robson, did you want to come in here?
Yes, thanks, Chair. I think it's, for me, it's echoing the last few comments and a few concerns that they've pushed the goalposts, to the left and increased, 16 and 17. That might be a good thing, and it might reduce assessment. But I'd have thought this was an ideal opportunity time. And maybe this is not for us, this is for the government, but there needs to be an intermediary assessment, maybe 15 to 23-year-olds. It seems that it's going from child to adult care and issues, but where that's a huge transitional period for any person, let alone somebody who's lacking a little bit of capacity. And if the funding is there for extra training, personally, I think out of our scope here, but there's room for professional training in that mid zone, if you like. Would that be something, or am I totally off the wrong idea here? Just interested in your thoughts, really. Don't have to solve the problem here, but
I think I've understood. So you're talking about training around the use of the Mental Capacity Act and helping younger people prepare and the care that they receive. Can I just check? Is that what you?
Yeah, I think it's also, and also almost putting in a new zone there. So we're not going from, we've moved the adult, we've slid the bar left to incorporate 16 to 17-year-olds, but surely there should be a complete section which is separate with focused care for the 15 to 22-year-olds, say, before they move into a full adult environment at 23 plus, something like that.
We have some pathways for young people called Preparing for Adulthood pathways. So they children's social care and adult social care work together, and I know that health colleagues do as well, to think about the preparation for transitioning into adulthood. The inclusion of 16 and 17-year-olds in part was brought about by a piece of case law that suggested that at 16, 17, when perhaps you're not subject to parental control and other areas so much that sort of closes that gap of a clear decision-making framework for a person who might not be able to make their own decisions. So there's a lot of conversations with children's social care. They're being included in the training that adult social care have at the moment for Mental Capacity Act. There's a lot of professionals, practitioners within children's social care who have gone on some specialist training recently that will allow them to be much more involved with LPS, the authorisation process in the future. So we're trying to increase the awareness and working with colleagues so that we try and bridge that gap of becoming an adult.
Great, thanks, sir. Yeah, that was, yeah.
Thank you.
Thank you, Sarah. I think, yes, no one's got their hands up, so Thank you. That's another one. It's sort of like watch this space, isn't it? Sort of further down the line. If we can move on to agenda item 8, which is the Day Opportunities Strategy, Case for Change. And can I ask Kevin Gillings, the Commissioning Manager, to present this report, please? Thank you.
Thank you, Chair. Good evening all. My name is Kevin Gillings. I'm the Commissioning Manager for Day Opportunities. And I'm here today to give an update to the Day Opportunities Strategy project, which I've been leading over the last year, and to give you information about a case for change. I thought it would be nice, and I hope the sound and vision won't fail me, but to put together a video about what are day opportunities from some of our local providers. So I'm just going to try and play that for you now.
Sorry, we haven't got any sound online. Sorry,
Apologies.
we can sort it.
My name is Kirsty Alice Masala. I'm making flower castle.
So this is a sunflower, isn't it?
Sunflower castle.
Everyone go. Does it not work? Oh. Okay. Go for it. Go.
I love pottery so much. I do my artist work.
Well, my favourite activity across the time is my favourite thing is going swimming.
Hello, my name's Amanda. I'm the pottery instructor at Volve. Evolve is a small day service in an easily accessible position in Southbourne. Hi, my name is Susie. I work for the Stable Family Home Trust as one of the day service managers, and I wanted to tell you about our new enterprise in Southbourne.
Okay, sorry about the technological difficulties, everyone there. But I hope that gives a flavour of what we're talking about today in terms of day opportunities. And a big thank you to all the providers who provided some information on that to share with you today. I should also just reference 15 Days in Clay, where you saw some of the lovely pottery work as well, also provided some footage there. So I'm just going to share a presentation today about an update for the Day Opportunities project. So we've been involved in a lot of project work over the last year, and you'll see the first three appendices attached to this report have been about a strategic needs assessment, innovations and good practice paper working with 20 other local authorities, and also a view-seeking exercise that we rolled out widely at the end of last year. All of this project work has led to 6 overarching priorities that were agreed with our co-production group. Our co-production group has been absolutely central to this project and has involved users of services, their parents, carers, self-advocacy groups, providers, counsellors have been involved, and also other local authorities and NHS Dorset. Polls were taken with the co-production group on each of the 25 proposals within these 6 priorities, with a majority of support for all, and that can be seen again in Appendix 4 attached to the report. So what are the 6 priorities? Firstly, transport was seen as a major barrier for people being able to access services, and that came through from our view-seeking exercise. So we were looking to review the opportunities to enhance the travel offer, and this would include travel training, looking at potentially voluntary schemes to assist people to and from services, and creating more local services for the local people to negate the issues of longer journeys for them. Secondly, we want to look at the cost and eligibility of day opportunities. There's a very wide range of fees for day opportunities, and we want to consider a framework of day opportunities charging. We also want to look at a review of needs assessment for access to day opportunities, as much of the survey returns we got back were saying people really enjoyed their day opportunities but simply wanted to do more. And we also want to facilitate the access to personal budgets, again with greater choice and control that personal budgets gives people, such as direct payments, and a greater range of services to access. Thirdly, we'd like to look at supported employment. We want to then enhance the offer of paid and voluntary work, and we want to look at our existing services and see where we can do better in terms of getting people into paid employment. We're going to work with our communities teams with that and their existing volunteer strategy. Fourthly is looking at day opportunities provision, and this will be supporting a mixed model of day opportunities within the available budget. This will include the development of community-based activities for people within their local area, hubs that will ensure that safe space for people who do require a building-based service, as well as opening their doors wider to community assets as community assets for a wider group of people. And this will be ensuring maximising the use of our buildings. We also want to focus on young people transitioning to adult services, as there is a particular need there in terms of having a greater range of day opportunity provision. And we also want to look at the innovation such as digital options, which have been very much explored during the pandemic and continue to be used and accessed by some people who really value those. We also want to look at specific services for marginalised groups, such as those people who have autism, a mental health diagnosis, and who come from diverse ethnic backgrounds. Fifthly, we want to look at accessible information. We want to work with the information and advice team and providers to have an up-to-date information on day opportunities. Working with other local authorities, we've seen technology that they put in place to look at real life access to day opportunities, what sessions they have available, costs and so forth. But we also got from our engagement survey that people want more traditional forms as well, in terms of emails or information that's available in, for example, in libraries and community centres. Lastly, we want to look at day opportunity standards and support. We want to develop a charter of standards, as one doesn't currently exist. We want a forum for day opportunity providers so that they can network together and they can have a closer working relationship with the authority. And we also want to look at the quality assurance processes to ensure that the outcomes for people are what we would expect, and they can be assured of quality. And lastly, we'd like to look at the data held by the local authority as well, to make sure that we've got up-to-date data and that we can actually review the success of the potential strategy. So looking at the financial data, BCP Council currently spends in the region of £6.5 million a year on contracted day services. There are approximately 30 independent day opportunity providers that we commission services from. And in addition, there are other routes of access to day opportunities such as self-funding, NHS funding, and personal budgets, chiefly direct payments. The Council has set an ambitious savings target of £1.3 million for day opportunity services over the next 2 years. As part of our work for our data and needs analysis, we went out to providers and we got lots of really good information from them. And included within that was about their current fees. When we looked at all day opportunity providers, the average hourly cost was £11.80. We divided providers into 3 categories. One was low cost, because this somewhat would skew the data, because these were organisations that may even have free sessions or very low entry fees, for example, to a social club with people with quite mild to moderate needs. And that came out at £1.99 an hour. Second group of community-based providers are generally smaller organisations who are based in the community. They may or may not operate from a building, and the average cost per hour for that provision was £9.51. For day services, we grouped a cohort together. There were larger organisations that generally operated from a day service building, but may also have outreach into the community. And the cost of those services averaged at £20.21 an hour, so was over double that of the community-based provision. We would make the caveat to that for day services that generally they are catering for people with more complex needs and also have all the running costs of a large building. So when we put these costs across a weekly amount, they are the following sort of bar charts. On the left-hand side, we have the total cost per provider, and on the right-hand side, the total cost per provider for commission services only. Significantly here, we have a much greater amount of money spent on that day service provision as opposed to community-based provision. And that is shown in these pie charts that relate to those bar graphs as well. On the left-hand side, for all services, 84% of spend goes towards day service buildings, 15% goes towards community provision. And when we look at commission services, this is more stark, with 93% of spend going towards day service provision and only 7% to the community provision. We benchmarked against other local authorities as well, who we've been in close contact with. And interestingly, from BCP's point of view, the average spend compared favourably per week in terms of a slightly lower amount. The amount of day opportunities that we commission is similar to local authority 1 and local authority 4, with a greater number of services that we commission, and we are less along the journey of modernising day services to a more community provision. As a result, the average hourly cost of day opportunities is higher. For local authority 2 and local authority 3, where they have only commissioned smaller amounts and have largely community-based services, their average hourly costs are significantly lower. So for all the work that we've done with the projects, we have looked at potentially 3 options. The first option is to make no changes to the current provision. This is not recommended, it's not in keeping with the findings of the project around good practice, the survey returns we received, and legislation around modernising day services, in addition to the impact it would have on our budget. Option 2 is to close all building-based day services and reprovision to community services, as some other local authorities have done. This is not recommended due to the significant impact it would have on people who rely on those services, and 55% of our survey return said they preferred having a day service building. Option 3 is about endorsing the recommendations of the case for change that I've outlined today. This will be a mixed model of day opportunities, including those community-based activities for people in their local area and the hubs that will ensure a safe space for those people who require a building-based service, as well as broadening that offer. This is the recommended option and is in keeping with the co-produced case for change. If agreed, the next stage of the project will be to co-produce, design and model the strategy for the next 5 years. We will be looking to agree the work streams and timelines and consider specific decisions about what services we require for the future model. This will include a fully costed business case, further engagement with stakeholders, and approval from boards and committees, such as overview and scrutiny, of the governance structure for this project. I want to thank you for listening and invite any questions you may have.
Members, do we have any questions? Councillor Devlin.
Yes, thank you. That was very enlightening. I got a couple of questions because you seem to be conflating the age groups who actually use the daycare. And I quite agree that the provision for the younger but more needy age group is totally different from the needs and desires and what we offer the older age group, although we do have a huge older age group. But one of my questions was, you were talking a lot about community-based providers. Now, are you actually talking about the charities? That, I mean, because basically that is what they are, isn't it? So we're talking about volunteer groups, like we've got one in Christchurch, Age Concern Christchurch. Surprise, surprise. Yeah, so are you talking about those sort of groups?
Thank you for your question, Councillor. They are a mix of provision as well, and indeed there's a lot of charities who provide day opportunities as well, but as well as private organisations and sometimes even individuals as well. Something we've been working with other authorities is something called micro providers, which are smaller providers. They a maximum of 8 people employed. And they can be, for example, and we already have that within our community as well with some organisations, a husband and wife who have set up their own little business and provide a local service for local people, a small cohort of people to engage in day opportunities. So there is a variety of a charitable as well as private provision.
Thank you. Oh, so.
Please, if I can, and also church organisations. So we do know that there are some church groups who offer things, sort of dementia support to groups. So it's not formal daycare in the sense of doing doing things to support people in a way that we might traditionally think about Tricuro or other organisations, but is playing a really important part about engagement and socialisation.
So we could basically say then that we're relying on a lot of volunteer groups and charities.
We could say that it's part of the mix, some of those volunteer groups are funded by us through contractual arrangements, of course.
Thanks. That wasn't a criticism. That was actually the way we've all been going for many, many years. Can I just have another question then as well? And well, this is the usual, not so much a question, more a statement. So I see in 13 on this paper, where appropriate, the focus needs to shift away from traditional, more expensive forms of building-based services. Expensive. And then I think you said at one point, and if I hear this word again, I shall scream, the council has set an ambitious savings target. Well, this is the bit that I'm really concerned about, that I wouldn't like to think, and I'm sure you'll assure me that you're not, doing a lot of this in order to save money. I'm hoping that we're doing this in order to provide better services people want, and the savings are just incidental and they're not ambitious at all.
I'll pick that one up, Councillor. Yes, so yeah, obviously if we modernise things and do things in a slightly different way or a mixture of ways, then it is a side product or a byproduct can be that there's some efficiencies to be made, and you're absolutely right. So we have set a target, but actually the approach that Kevin's laid out is giving us an opportunity to perhaps maximise that saving, but some of it's to go back in to create an opportunity to do things differently. So it isn't all about saving money, it's about investing slightly differently to give us a better, wider range of offers.
Can I just suggest then, Chairman, that should come out in the paper, what you just said, Phil, what he said.
Yeah. Thank you.
Councillor Butler.
Thank you, Chair. Yes, the local authority costings you had on the slide there about the different local authorities, were some of those in rural areas or were they all urban like BCP?
So all of the information that we got was from the BCP area. There were some outliers just into Hampshire, but yeah, they were on the border.
I think which other authorities did you?
Oh, sorry, the other authorities. My excuse me, Councillor. So the other authorities, we engaged with 20 authorities. We've been in very close working partnership with particularly Dorset, Hampshire, Southampton, and Birmingham, interestingly as well. But the local authorities, I gained the information on that on the basis of anonymity as well. So I can't say what local authorities they are, but I can say that they are. There are some local in the southwest region within that.
So if I may, Chair, I think Councillor, I think you're trying to find out are the comparable authorities. So are some urban compared to us and some rural? So in the comparison, without naming them.
Yes, but yes, they are. Yes, we have. There's some rural authorities with that, and some urban ones as well within that benchmarking.
Because I think my rural a community, naturally they're more supportive of their residents, you know, on their own often. You know, they'll have little set up organisations where they help people, more neighbourly often than some of the urban areas. So that might change the balance slightly in some areas.
Councillor Matthews.
Thanks, Chair. Yeah, it's actually, I probably should declare a belated interest. It's Phil mentioned dementia. My wife actually works for the Alzheimer's Society and runs memory cafes throughout Dorset. So for transparency purposes, I thought I ought to declare that.
Yeah, it was interesting on your video because I think a lot of people think that these day opportunities are for old people. So seeing that video full of young people there sort of enjoying themselves and learning skills and everything. That was really good. But I just wondered, you did have in your report, and what did the older people want to do in their day opportunities? Did they come up with doing? Did they say they wanted to do pottery and things like that as well?
Thank you, Chair. Yes, many of our day opportunities I visited, particularly over the last year as well, have had a real mix of ages. The survey gave us different opinions on that. Some people did prefer people their own age and of similar interests, and others prefer much more of a mixed group. We've engaged as well with our older people's services, and again, what we found from that as well is that people want a mix. Some people do prefer, again, a building based around similar age people for something that's indoors, and particularly if there are issues of safety as well for individuals. People who have potentially more advanced dementia, for example, may value a more building based environment, something that's quite familiar and secure. But we also met plenty of older people who wanted to be out and about, doing things, very engaged in their community and giving back to the community as well. So again, it is very much a mixed provision that will be needed.
Phillips, did you have a question?
Many of the day opportunities for youngsters, historically, the places and venues were closed some time ago, and my heart was broken because they cherished and loved the friendships, going somewhere, the purpose in life. Are we, from your discussion, are we establishing new ones again and reopening the ones that are being closed in different aspects with different projects? Have I read that correctly, or the ones that are closed, are they permanently closed and not to be revisited? And I have a part 2 as well.
Yep.
Sorry.
Okay. Thank you. As the question that came in at the start of the meeting that was answered, so the temporary closure of day service buildings that were brought about by COVID in the main, the people that were going to them have either gone into community projects and community support or gone to alternative day provision. So some people have gone to other day centres and are mixing and or in separate groups within those, but they've been accommodated within space. Yeah, and sorry, but the point to be stressed is that no decisions have been made about any permanent closures at all. That this is part of the work that's now going on. If Cabinet approve the principles, the case for change, at their meeting in a couple of days' time, that will set out the principles around modernisation, but view seeking and working with people who currently go to any day opportunities, what they want in the future and how we co-design with them those services, some of which are no doubt be buildings based, some of which are community based, but things associated with day opportunities such as work, travel, and that links back into your own community sometimes as well, not just the building that you may go to.
So please do your best to try and reinvent and bring it back to where it was, because it was very healthy. Finally, as well, for the record, I think you did mention that some of the other boroughs have closed or are not pursuing the day centres. You stated that your aim was to continue and to blossom in that direction. Is that definite, or is that your aspiration?
I think what we've learned from this is as that option 3 suggests, is we don't want to stay as what people have told us. We don't want things to stay as they exactly are now. There is a need, there is a desire for more people to be able to access the community and do more things in the community. But we don't want to go to the complete extreme of let's close all our building-based day services, as some areas have done, and push it all out to the community, because what people have said is no, we really value, and especially for some of those people with more profound needs, you do need buildings which are fully accessible and can provide a safe and secure place that provides those individuals the support they need, but also gives their carers that feeling of they know that their loved one is safe while they're at their day opportunity. But it is getting that mixed model, so we do want to actually have that balance, and it's what Kevin has sort of showed in that is actually perhaps the balance is a little bit too much. Currently all of our money tied up within our within traditional building model. We do want to move some of that around so that we have a greater provision of community for those that want to, and that's what the report sets out to do, and that recommendation of that a more mixed model.
Thank you.
Thank you. Councillor Evans.
Thank you. And I'd just like to thank the committee, because actually most of what I wanted to cover has actually been asked. So thank you so much for really taking the time to look at this report and think about it. I'd also like to thank Kevin for such a really lovely presentation, and what a wonderful video to watch as well. Thank you. I'd just like to reiterate really actually what Councillor Dedman said, and thank you already for your reassurances that this is not just being done to save money. However, when we make a case for change, how do you do that when 85% of respondents to the questionnaire were actually happy with what we're doing, and over half like the day centres? So I just want to ask, does option 3 mean additional day opportunities or less day opportunities for our residents? Because we've already said if we lessen the opportunities, we're going to increase the care needs, so that will be more cost anyway, and we're going to burn out our carers. Absolutely support the modernisation and improvement. I think people have already said they didn't want digital, which is usually our sort of go-to of, oh, it's fine, we can do everything online, it'll be a much cheaper and you'll love it. And they all just said, no, actually, we don't want that. I'm also a bit concerned about the focus on younger adults. It was wonderful seeing the things that they were doing, but as we've already said, the older people have different wants and needs, so I want to make sure that those are addressed as well. I'm not sure I've even asked a question there, but it's been a really interesting discussion, and obviously it'd be fascinating to see the business case that's developed. Thank you.
I think if there was a question in there or somewhere to sort of provide some reassurance, it was around the your question around, you know, are we taking day opportunities away? It's not about taking the day opportunities away. It's about maybe just about broadening the types of those day opportunities are, and so that people have that more choice around if they want to access things in the community or the community that's there, but still recognising for those people, the 55% that still said they still really would value a building-based service, so that's still there for them as well. But it is about trying to get the balance right.
Thank you, members. Is that all the questions? Now, we have been asked, we've got some recommendations here on the front page of the agenda, and we've been asked to vote on these. Now, do you want to vote on them all 3 separately or all 3 together? Do you want me to read them out for you? Right. A. The strategic priorities for day opportunities set out in point 61 of this report, which underpin the future strategy and its implementation. And yes, these are for recommendations to the Cabinet. Yeah. And B, the mixed model of day opportunities includes community-based activities for people within their local area and hubs that will ensure a safe space for people who require a building-based service, as well as broadening the day opportunities offer. And C, officers to work with stakeholders to redesign and then recommission services to meet the new mixed model referred to in recommendation B. Now, do you want to take them separately, or you're happy to take them all together? Yeah, so all in favour?
And online.
No, he can't vote, he's not
No,
here.
Mark. Oh, you can't vote, okay.
Sorry, Mark.
That's unanimous.
Yeah, that's unanimous. Thank you. So moving on then to agenda item 9, and that's the Tricuro update. And if Phil Hornsby can introduce.
Thank you, Chair. I will. And I just wonder, Rich and Kim, whether you'd be better sitting next to see that screen, because that ancillary screen's not working tonight. Thanks, members. So I just want to do a little bit around the journey we're on with Tricuro as a company and the arrangements with the joint shareholder arrangements with Dorset Council, and then I'll allow 2 colleagues from Tricuro to introduce themselves, who will take us through a presentation about the great work they're doing. So first of all, I'm not going to rehearse the journey that we've been on with Tricuro that started in 2015, where the three previous councils came together to set up the organisation and each had an equal share. But where we are now is that with LGR, Bournemouth, Christchurch and Poole Council own one share in Tricuro and Dorset Council own a share in Tricuro. Dorset Council decided to withdraw from the contractual arrangements with Tricuro and set up a different company, Care Dorset, and that came into being, and the transfer of those services that serve the Dorset population are now transferred back to Dorset Council via their Care Dorset operation. That leaves, at this moment in time, two shareholders still of Tricuro. So discussions are ongoing with our colleagues in Dorset Council, both at an officer level and a member level, to work out how we acquire both shares in the company so it becomes wholly owned by BCP Council. I'm hopeful that we're making some progress in that, but there's some technicalities around just liabilities, links to pensions and things like that. So we will work through that together and come to the right place. And I would hope that early in the new financial year, I'll be able to come back to committee and give you news about how we've come to that arrangement. So really, what's more important to focus on is the work that Tricuro have been doing over the recent months and years, and how that is translating into the quality of care our residents receive. So I'm going to try and share the presentation, and hopefully that will then allow Kim and Rich, and if you can just introduce yourselves when I get this right. I think it's that one. I just need to do a slideshow. Come on. There we go. Right, over to you, Kim and Rich.
Okay, hello everyone. It won't surprise you, I'm Rich.
Sorry, I should use the...
Oh, of course I can. It won't surprise you that I'm the rich half of Kim and Rich. My title is Corporate Director. I'm in an acting role at the moment supporting the executive team at Tricuro.
Hi, my name's Kimberly Devlin. I'm the Executive Director of Operations at Tricuro.
Sorry, that's me.
So without further ado, we'll launch straight into the presentation if everyone's happy. So if we start off with Tricuro and our quality assurance.
Sorry, just give me a second.
Lovely, thank you. So an overview, obviously quality assurance will absolutely encompass everything that we do within Tricuro, as well as safeguarding. The highest priority is keeping people safe, making sure that our workforce are all supported, and that we are really delivering what we need to support people within the local community, but also within our services. So this presentation will capture quality assurance, safeguarding, organisational development, recruitment and retention, and a whole lot more. So as you can see, it's a busy presentation. It's been a really busy couple of months. So quality assurance has been really exciting for Tricuro, especially in the last year. We've effectively relaunched the whole of our quality assurance, and one of the most pivotal groups that we have within Tricuro is our Quality Assurance Committee, which we have now established once again. It lapsed during sort of just COVID times, but we're super excited that we've got our Quality Assurance Committee back. We have established safeguarding champion networks, and we have relaunched all of our full compliance audits. That's across all of our services. So not just our regulated services. Actually, what we're doing is we're looking at our supported living, we're looking at day opportunities, employment support, to identify where is our benchmark in the here and now. Is it good? Where do we want to be? And more importantly, how do we do that, but bring people with us? So we're not doing 2 people, we're bringing everyone with us. We finally hit sort of 2023, actually using some digital data analysis and dashboards, which has been fantastic. With a company with so many different services, it's absolutely crucial that within HQ and every level, we've got a really clear understanding as to what is happening in our services now, not in 3 months' time, not last week, what is happening every day. So I can log on and I can look across the whole of the company and understand, okay, what accident and incident has happened in the last 24 hours. I can also map to make sure that everything's been done to make sure that the person is supported and the staff in service. We've talked about CQC, Single Assessment Framework Readiness. We've been launching a whole host of workshops for all of our staff to prepare for the new changes. And actually, we're getting a lot of our staff really excited about this journey. It's really a perfect time for our services to showcase all of the fantastic work that they do and really embracing the statements around we do and this is how. And it's not about words, it's about showing an ethos, a culture within our services. And I think that that's absolutely what it should be about. I absolutely understand you need data, but for me, there's a whole lot more than data that encompasses CQC. We've got the fully digital quality and compliance system in 2023. We're looking at the electronic MAR charts. So it's like your prescription charts will be in electronic. And really exciting, we are now part of the Restraint Reduction Network membership. And that is really huge. So what we're believing in more and more and what we're creating within all of our services is actually what can we do to support you, which in turn makes our quality assurance process robust, keeps people safe, but also gives you the support that you need to do your job. As a result of some of the positive changes, we've got increased occupancy rates in residential care. We know that our care plans are being reviewed. We're really promoting the safety of people by ensuring people are having boosters. We've got CQC ratings of being good. And I think what's incredible is the platinum status in the GSF, which is the golden standard framework. That's an exceptionally high award to be gained. And to have that at 3 of our sites is something that we're incredibly proud of. 91% of our health and safety actions are closed. Obviously, we'd love it to be 100%, but we are realistic and sometimes we may not always get there, but we're always striving to get there. And we have accredited positive behaviour support instructors now employed within our services. And that was a result as to understanding what can make people angry, which may make them at risk of causing themselves harm or others. And what can we do to support our staff to help people to reduce and lessen those risks? So safeguarding concerns. We are absolutely always going to have safeguardings, and I would be incredibly concerned if we suddenly had nil. When people say, I've got no safeguarding concerns, actually that makes me very, very uneasy. What I would say is that we have seen a decrease in safeguarding concerns, and I firmly believe that that's a result of what we have invested in, so more training for our staff, making sure we're a company who learn. So you learn from what goes wrong. So there's no shame, there's no blame culture. Actually, if something is happening in one service, it's really important that we share that with all of our other services to learn from. So it's an open culture within TriCure. This is what's happened. This is what we've done. This is what we're going to prevent. And that is being shared with every staff member at every level, and actually with residents, families, people who use services. We're very, very transparent. And we've tried to make sure that we understand and have some assurance that people within services understand what safeguarding is. And I've attached our safeguarding survey results from 2022. And I think the statistics are actually really positive. And we're also thinking more about making safeguarding personal. So a lot of education is going on within our services. And as I say, with people who use services. So actually we're educating people within our services. Do you know what safeguarding means? Have you ever experienced anything? Next slide, please. Incident and accidents. So what we can see over the last sort of from February 2022, it has been peaks and troughs. But what we have now in place is something called heat mapping. So this is a really beneficial piece of equipment. So what it will do is it will tell you about trends. So actually, is there a certain day, a time of the day that accidents and incidents that appear to be happening? That then enables us to root cause analysis. Okay, perhaps we're having falls at 6 o'clock. Okay, where's the location? What is happening with the staff? So our staff all running around getting meals out for people. What do we need to put into place? It is all a work in progress. Our highest amount of accidents and incidents have been, I would say, falls, in all honesty. Some of that is because the people coming into our services have more of a complex physical need. We've also got higher cognitive impairments within our services. That doesn't mean that that's okay, but it's something to consider around our mitigation. So actually, we know this is a problem. So what are we going to put in place to try and minimise those things happening? So my managers can complete a monthly root cause analysis that's shared with the wider company, and that's how we can ensure that people are making sure that all cases are reviewed and acted upon. And I'm going to hand over to Rich now and breathe.
Okay, thank you, Kimberly. So my focus here is to talk through some bits and pieces to do with the organisational development side of things. I'm starting here on the apprenticeship levy. So we've returned to some face-to-face training for quite a while now, a number of months, if not longer. And we have also built ourselves a dedicated training space to enable that to happen, which is very exciting inside one of our care homes, and it's easily sort of local and accessible for everybody. We are coming to the end of our initial contract with our online provider for training, Elfie, e-learning for you. So we're looking to reprovide that by June later on this year. And that's quite an important process for us. I mean, they all sort of do what it says on the edge of the tin, you know, the videos and then subsequent questions afterwards. But actually, we're looking for a little bit more support in terms of changing those courses to meet our specific needs working forward. We're working very closely with partners in the local area and further afield, 3 named there. And Paragon are our main apprenticeship support. I think today, actually, we hot off the press, we actually got named Provider of the Month, didn't we, from Paragon?
Yes, we did.
And I just wanted to talk a little bit about our apprenticeship levy as well. If you want to go on to the next slide as well, Phil, thanks. So we pay into an apprenticeship levy, as I'm sure you're aware, and that is based on the size of the company. In the previous year, we've had 24 active learners who are utilising some of that funding at different levels, as you can see. If you can move on to the next one, Phil. But the point that we've highlighted internally is that actually we've got a huge amount of funding there. There's a bit of a leftover legacy from COVID to utilise more fully over the next coming up to 2 years or so, upwards of £110,000. And if we don't use that money, we do actually lose it. So it's a very important focus for us over this next period. If you want to move on to the next one, Phil, it explains that to that end, we're actually earmarking 50 new learners internally in TriCuro to take forward different levels of apprenticeships and support and different diplomas that will see that levy spent to good use. People that want to sign up to those courses, it's not something we're forcing upon them. It's part of our culture that we're trying to build at TriCuro. And this will mean that around about 10% of our workforce are actively learning at any one time. And you can see there the different levels of funding that we get from the Adult Social Care Workforce Development Fund. So this is really important for us because not only do we have to build up our levy to pay for the courses initially, but then when they're successfully completed, we can actually put in an application to get some of that funding back. That can go straight back into our support our training budget, which is what we need. The next one, Phil, thank you. So it came up earlier in today's meeting actually, but the focus of needing to really improve and focus in on personal development. It's not only linked to and important for retention, but also a recognised recruitment strategy now as well, is to really make that clear for those looking to join TriCuro over the coming period. Supervisions are needing to be far more reflective of their practice, recognising their gaps, and obviously then that leads into the work with the levy and the apprenticeships and diplomas, etc. PDPs and supervisions are also going to be part of our corporate induction, which is onto the next slide. So this is an exciting development for TriCuro and something that I know Graham, our MD, has been very keen on for ever since he's been at TriCuro. We are looking to begin this April-May time this year. It's being developed by our organisational development lead in conjunction with Graham and the executive team and sort of wider groups. It's going to largely form a 3-day corporate induction covering the items listed there. And actually then we'll set aside some time for learning, statutory training, and some of that will be a hybrid, as it states there, between face-to-face and online. And all sort of filtering through and building towards that PDP, so that individual as a learner is really clear on what they have to achieve and what is open to them and what the possibilities are as they work through their career with TriCuro. Day 4 and 5 will then be based at the service, getting that more finite, specific training from the service type that they're joining. So recruitment and retention, well, we had a gap that we needed to fill just like any other provider at the end of COVID. Not only were we hit by the, as it was then, the statutory requirement for vaccinations, but generally people feeling a little bit disillusioned with the sector as a whole, as I'm sure you're aware of and discussed previously. But actually I'm delighted to say that we've closed that gap over the last 6 months or so. It's all about, in my view, being creative with the funding that we have. So we have very much focused in on apprenticeships, partnerships and sponsorships. For me, they're 3 key things that have helped us develop and close that gap over the last 6 months, not only to sell and explain to those that are looking to join TriCuro what has happened, as I've explained, with the apprenticeships and the opportunities for learning and developing your career, but actually looking to work with local volunteer groups and other providers even. We have a very exciting project that is nearing completion actually with the NHS, whereby they have looked to second a number of employees into TriCuro, who then after 18 months learning on their secondment will move across, I'm sure, seamlessly into the services that they are currently working in. That's they're due to come over, I think it's next month they start. And actually we're working with the NHS and some other local larger providers to see how that relationship can develop, because what we don't want to continually be in that situation where we're just taking from other providers to meet our need. We need to support and get new people into the sector. It's very important. So as I'm sat here now, we only actually have a number of vacancies in our reablement service. We're really trying to build those hours. With the support of Phil and his team, we've got some extra funding for a new community therapy assistant position, which is going to support the hours needed there to grow that service back to where it was a couple of years ago. And I think that's all I need to say on that one, Phil, if you want to move on to the next one. So this is all about workforce, namely sickness, absence tracking, excuse me. We have a target set for ourselves of 4% of, that is percentage of days lost to absence, primarily sickness. That's set as a direct sort of comparator looking at other providers in a similar sector. Actually, when I first joined TriCuro, I think that was upwards of about 9%. So that was coming up to just about 3.5 years ago. January 22 saw that drop to 5.4, and under my guidance to HR support, the team that I run as part of my remit, we've actually got that down to 4.7 in January. Again, another hot off the press, only Friday, because this was developed a couple of days previous to that. We've actually dropped in February to just 2.76% of our percentage days lost to sickness, which is a huge difference to where we were a few years ago, and it's testament to the training and attitude, accountability that and support, I should say, as well, that we give to those that are going through illness, time away from work. A couple of other notes there, which I think have largely been covered off, but we are working with our BCP commissioning colleagues, running our own day service client survey. That was completed at the end of last year, and we're compiling those results. And we're looking to complete a full TriCuro staff survey later on in Q3.
Thanks, Rich. Our reablement team. Reablement is pivotal within our community, as I'm sure everyone will agree, and we operate our service within BCP. So within the team, we have reablement staff who are also level 3 trusted assessors, and we have also employed occupational therapists, which are helping to instill that therapy-led service. So essentially within reablement, our staff will support people out of hospital to get them back home as quickly as they can, with the aim of making them as independent as possible. Equally, the team also support the community by stepping in to support people at home if they're becoming unwell, or to really avoid a hospital admission or a placement within a residential care. Alongside reablement, we've got our intermediate care service, which is Coastal Lodge. And the aim is that the reablement team and the Coastal Lodge service will, in essence, create one central hub to meet all of the needs within the community, other services, and other partners. We've created an occupational therapy hub team to work with our staff, and this has enabled the team to make sure that the people needing support are signposted to the right setting to meet their needs. Both Coastal Lodge and reablement are integrating with other services such as the NHS and primary care, which is long overdue. We have also recently integrated the OT hub team into the Acute Hospital Trust. So we've just started at Poole General Hospital at the moment. It's hoped and anticipated that we'll be able to enhance the number of safe discharges out of the hospital, but also identify any other people earlier in their hospital stay so that we can start hospital discharge planning sooner. In essence, this allows the person to go home with a reduced package of care, and prevent them really being placed into inappropriate settings. We believe that we can support many different people within the Acute Trust, and by piloting a hub team, we have evidence that referrals have been signposted to the most appropriate setting via our own assessments. People who were discharged with planned dom care packages actually have been re-abled to go back home either independently or with reduced packages of care, which I think is a huge achievement. We've been able to re-able people in bed-based settings sooner and get them home faster, because actually that's where they want to be and quite right. We've prevented admissions into settings by working with the person to re-able them and source equipment to help them to remain at home. And also made sure that we're signposting people to other services and sectors, so actually the voluntary sector as well, making sure we are really integrating within the local community. Because obviously we know as well that while people are in hospital, they will decondition quite quickly. And so our aim is to step in as soon as we can to help that person home. Next slide. So the reablement hours within BCP, they have fluctuated. What's important to note with these reablement hours is we have got a large amount of vacancies, and actually these hours are pure physical reablement. So this excludes the travel time, the staff breaks, all of those other things. So actually we're delivering, say, 3,600 of pure reablement. That is from the moment that staff member steps into somebody's home and they leave that person. in essence, if you put into account travel time, it takes you to roughly around sort of 5,200 hours a month, you know, loosely. So I think that we are delivering a good amount based on the resources that we have got. And obviously the aim is that we can enhance on those hours in line with more recruitment of community therapy assistants. Next slide.
Okay, we're getting near the end now. I think this is the final slide but one. So I think you've had this in your pack prior to the meeting, so I won't talk through it all. I just wanted to focus in on the Discover Digital and AUB links there. So Discover Digital is a new service that Tricura have built over the last few months. It's really an option. It's, as Joe mentioned earlier, it's that choice that we're trying to give everyone, that actually if they need some extra support online, they can get that from us. It adds that social element when maybe they can't actively get into a buildings-based service, or actually they just want to work from home attend a service from home, maybe with their carer as well. And actually we do offer carer sessions there too. Recorded sessions are also available, and we're building those up over the next coming months. AUB, so Arts University Bournemouth, we're now an associative partner of the university, which is incredibly exciting. We've got lots of irons in the fire with them. They've supported on a photography project, which is linking into our marketing at the moment. And actually, we have a design challenge that we're setting them in June. But this here talks around that they're also linking in with us on a project around assistive tech. So I've laid down the challenge of trying to define exactly what assistive tech means for Tricura. And actually, they're going to be visiting a number of our services, Discover Digital being one, and also Parkstone Connect and Reablement, Coastal Lodge, to really build up that idea about how they might be able to support Tricura in the future, talking to residents, clients, and building up that knowledge base in order to then actually tangibly make something that could assist us in the future. And it's just a list really for you to recognise the partnerships that we are building. Community Action Network, they are actually on the same floor as us at Beach House, and we're building those networks. I know you are, Kimberly, as well, with their MD. National Care Association, AUB, as I've mentioned, and others, not least our BCP commissioning partners. I think that might be presentation.
Thank you very much for that, and you have to be congratulated on your lack of staff vacancies. They'll all be coming to you to see as a benchmark for that.
It is, you know, it's an ever ebbing situation, isn't it? And we're pleased with where we are at the moment. We know it does go up and down, but actually I think some of the things we're putting in place at the moment to combat that should see us through in the future as well.
So once you've trained them, are you finding that they're staying with you then? They find that there's a career opportunity there for them, so they are staying?
Yeah, actually, that's what all the statistics tell you as well, isn't it? If you look after your staff and you train them well, then they are invested in the business and want to stay and progress. And progression is for some, it's not for everybody. If you want to, you know, work as a care assistant and you found your calling in life, then that's absolutely fine. And we would build that program around you too. But for those that do need it, career progression is there within.
Any questions, anybody? Councillor Johnson.
I just wanted to say I liked what you said about the learning from events and moving forward together and no blame culture. I think that's really important, because I think that's, people do feel supported with that, and I think that's to be commended. Well done.
Sorry, with the absence, you mean?
But that's why people are staying, isn't it? Because they feel supported.
Absolutely,
you know,
yeah, definitely.
Staff retention is a huge problem.
It is
for a lot of places.
Thank you.
Councillor Butler.
Yeah, can I ask the Coastal Lodge, whereabouts is that? And you said it's intermediate care. Is it for people to go from hospital before they go home, and also soon to become a hub? Is that going to make it bigger, or how is that going to sort of develop?
Thank you. So Coastal Lodge is centrally based. It's actually down Everton Road, so St Paul's roundabout Asda. It's just off down there. But you're right in essence. So Coastal Lodge is a place where people can go to begin their reablement. It's either a step up or a step down sort of service. And what we're really proactive in and what we want to achieve is the reablement hub. So what that means is that you've got your reablement staff integrating into Coastal Lodge in line with dependency capacity. So they're sharing skills, but also picking people up seamlessly. So actually, if you've identified somebody nearing to go home, actually you get your reablement community staff to start coming in to see them and then taking that person out. So it's a much more individualized sort of process. And it means that that person knows the staff already as well. It also means that you can be more efficient with your resources. So actually, if you haven't got as many people in Coastal Lodge, potentially you could redeploy some of those staff into the reablement and vice versa. So it's about a flexible and dynamic workforce that's efficient and sustainable to meet the community needs.
Sorry, can I just ask something else? You've got one in Bournemouth. Do you think you'll have one in Christchurch and one in Poole as well?
I would love that to be the future. I'm just turning around to Phil. Yeah.
So we already have one in Poole, and that's Figbury Lodge. It's not run by Tricuro, but Figbury Lodge, if you remember, was developed up on Canford Heath. So that opened in 2019. 40 beds are dedicated to transitional care, so rehab and reablement. So that's operated by a different company.
What I would add into that is that we are utilising some of our other beds as well. So actually, if there was a vacancy at Avon View to cover the Christchurch area, if there is bed availability, we do deploy staff to tend to people. So actually, we'll refer somebody to Avon View for bed-based reablement, and our reablement staff will go over to Christchurch, start reabling them and getting them back into the community. That's all based on bed availability though. Yeah.
Yeah, just to come back on the point over there, I don't know who was said about Christchurch and elsewhere. Any beds that we have, we will look to see if the person can be catered for in any of those beds. So if there's somebody that it's appropriate for them to go to Figby, but they live more over on the Bournemouth patch, for instance, where Figby is on the old Mitchell House site in Canford Heath, then it would be around who can cater for the needs best, and then we would make sure that we're able to support those individuals through that transition into the best bed that can meet their need across, you know, all of BCP. So we would hope that there's no inequality for any of our residents based on what they might need.
Try and round that off. So Fairmile Grange, which is in Christchurch, near Christchurch Day Hospital, is currently being used as a similar thing. So many beds have been allocated for step down from hospital with wraparound support provided by Dorset Healthcare to enable people to get back home quicker. So that's part of the initiative. That's some additional funding from the NHS that came out to cover winter. If we make it successful, then there's no reason why that can't be extended over a longer period of time.
Thank you for that. Councillor Phillips.
Does your role slip into residents at home, or does it cease the minute they leave a bed in one of the establishments that you are looking after?
Hi, do you mean outside of reablement? So actually just somebody coming into residential and then going home? Does it?
Re-enablement in the home, isn't there, after hospital? So are you already involved in that? Might you become involved in that? And that's really what the question is. Thank you.
Absolutely. So we are involved in that. And especially with our staff being skilled as trusted assessors as well, once somebody is re-abled and back home, even after they have sort of ceased their sort of 6 weeks of employment, our staff will do a touch-in visit as well to make sure that they've still got any other support should they need it, or to refer them to other services within the community. So an example would be about 2 weeks ago, we re-abled a person back home, independent, but actually when they undertook a welfare call the next week, she said that she was really lonely. So actually what we then were able to do was link her up with the Community Action Network and Befriending Society, so that actually she could have those links. So we absolutely don't believe in sort of job done and off you go. We always make sure that people have got a signpost of services, who to contact, where to go, and we'll always go above and beyond to try and support people.
Is that online for people to see when they look up Drag Euro? Can you see?
I don't think it probably is there actually, and I think it's a really good comment, and I think it's something that I'll take away.
Thank you.
Councillor Dedman.
I just wanted to congratulate you on the days of sick reduction. That's absolutely fantastic. Well done. And especially at this time of year.
Yes, thank you. Yeah, I thought you'd like the hot off the press from Friday. It was based on February's data, so yeah, we're very pleased with that. Thank you.
Thank you. I think. Okay, Councillor.
Yes, thank you so much. It's been so lovely to have so many positive stories, and really lovely to see the service is working so well. Just to put a slight spanner in the works, so just wondering about how you're being impacted by the cost of living crisis, because obviously it affects so much in the sector in terms of fuel, energy, food and everything. So just wanted to hear a bit about that, if we could please.
So of course it's having a huge impact on our staff, just like it is anybody across the country right now. The good news is that we did get an uplift for all staff as part of the NJC back in November time, I think that came through. So that did help a lot. As an average, I think there was about 8% increase in wage. Of course, it's hitting all providers in other ways to do with energy costs increase. So we're constantly looking at our medium-term financial planning to ensure that we're catering for that and working with commissioners on how we deal with that looking forward.
Yeah, so everybody, yep, thank you. Thank you very much for your report. It's, yes, it's, I think we've been looking forward to that because we haven't heard from you in a while. So thank you for bringing that to us. Yeah. So if I can move on to agenda item 10, which is the BCP Council Adult Social Care Market Sustainability Plan. And if I can ask Joe O'Connell to present this report, please.
Thank you, Chair. I'll just give colleagues a chance to get themselves set. Perfect. So, yeah, thank you for inviting me this evening. Hopefully you've had a chance to read through the report. I don't intend to go through it in a great deal of detail here, but would just like to summarise, if I may, a few key points. So just as a bit of a reminder that all local authorities in England were asked to undertake fair cost of care exercises, working with their local market for both 18 plus domiciliary care services and 65 plus residential care services, and to produce a market sustainability plan. So BCP Council, we undertook those exercises, and BCP Council is using the findings of that to distribute the grant that we received in this financial year, but also to help inform future fee settings for the market. But in addition to this, we're also undertaking further exercises with our supported living, our extra care housing and our 18 plus residential care sectors. So we've got a wider market view of what we think a fair cost of care is, and we can use that across all of our frameworks moving forward, and obviously use that to have a much more sort of considered offer and how we utilise the grant for government that we'll have for the year ahead. So we've submitted both those cost of care exercises and a draft market sustainability plan. Government have not asked us to make any changes to the submissions that we made back in October, which is positive, unlike some other authorities that were asked to make changes. They have issued a revised template for our market sustainability plan, which just has a couple of extra questions which we've covered in the report there, which we're just making sure that they're compliant with before we publish. In addition to that, we've also shared the draft market sustainability plan and had a couple of workshops with providers. And I think at the time of writing the report, and those workshops were just happening. So we had a good turnout with those. 29 providers attended the recent workshops. I think the feedback that we got on what we'd put into the market sustainability plan was positive. There were no concerns about what we'd actually said we wanted to focus our energies on in terms of that market sustainability plan. But they obviously fed back some of the experiences they're finding as providers, both in terms of those challenges around workforce and recruitment. So it's really positive to hear what our colleagues from Tricura have just been reporting. And obviously, again, as you expect, those increased cost pressures on running costs at the moment. As I've said earlier this evening, there are two overarching priorities within the plan. One is around how we can support people to go through to maintain their independence. And again, we've just heard Kim talk about the reablement services, one example of those intermediate care services, and some of the ones that Phil's have touched on, which are really trying to support people to maintain their independence and reduce their reliance on long-term care, and also where we can to reduce our reliance on residential care when there are other forms of support that enable people to remain at home or for as long as possible. And the second one is again that focus on how we can continue to support the workforce, working around issues such as a really positive recruitment campaign that I hope you may have seen yourselves on things like Facebook and things like this, to really support recruitment campaign, and also some of the training that's done. And that a lot's been done in not only training that we offer as ourselves, but working with our NHS Dorset partners. And again, we heard an example of that around how they're offering some of that career progression and apprenticeship stuff through the NHS. So I just wanted there the sort of key points of this, and we would welcome any comments from members or any questions on the details of that report. Thank you.
Thank you. Any members got any questions or comments? Yes, Councillor Lippman.
I don't think, well, you did sort of cover, but in, hang on, so that block 3 on the paper, continue to support with overseas recruitment and opportunities for housing for care workers alongside NHS staff. That sounds really a brilliant idea. So, I mean, you know, how is it working, or has it not worked as yet? Or is it just a thing you think you might do?
No, so far we've invested in, I think, around £78,000 worth of grant funding we've used to support with bringing additional care through the overseas recruitment campaign, and we've working with some of the other grant. We've got some additional funding that has that has meant that we do have an increased workforce within our providers. That's managed to sort of in terms of for our framework. We are seeing some challenges around that, and some of the feedback we had from providers is actually, and it is a bit of a challenge that we face locally in BCP, is that some of those people have come into the local area, but then actually are struggling to afford to stay in the local area because it is expensive here. So we need to continue looking at that. I think the aspiration around how we could look at key worker housing is something we're looking to try and explore with the housing colleagues, and sort of say, you know, where are the opportunities in this around moving forward. It's something that might well help, because again, we know but there are some competing priorities across BCP for housing, but it's something we're keen to try and keep those conversations going where we can, and to look at what opportunities there are to support people who want to work in the care sector but are struggling to find affordable housing, if there's ways we can do that as we move forward. And we fed some of that into some of our colleagues in housing.
Can I just say, Chairman, I'm really supportive of that. I think it's a really good initiative, because it is so difficult to rent round here, and I know that to my cost because I rent, and it really a very, very good idea. So well done.
Anybody else? No. Well, thank you very much, Joe. Thank you. So We move on now to our portfolio holders update. Can I ask Councillor Karen Rampton to give an update for us, please?
Hello, yes, thank you. Thank you, Chair. Can everybody hear me okay? Yep.
Yes, thanks. Yeah.
Okay, thanks. So just a couple of things, Chair, that I wanted to mention. I had a really interesting
on the screen now, Karen.
Okay. Does it come back?
No, can you turn your camera off, please, Karen, because you're breaking up.
Is that better? Yeah, that better. Okay. I had an interesting visit to what used to be called the Anglo-European Chiropractic College, and it's now AECC University College, although they're hoping to rename it. They may have done that already, actually, to better reflect what they actually do there. And it was an absolutely fascinating visit. I went with Bob, actually, the mayor, and we were shown around the campus and see what they do, to see what they do there. And they've still got the chiropractor side of things, but they do a load of other stuff as well, which is I absolutely recommend a visit. And there's lots of possibilities, in fact, already happening, where we can work in partnership with them to help with our reablement and physio sort of needs. So that was really interesting. And if anybody does get a chance to go over there and have a look around, I thoroughly recommend it. The other thing, Chair, I wanted to mention was I was just going to give the committee an update on where we're going with damp and mould. And you might think, well, that's more of a housing issue, but actually it's massively important to people's health, isn't it? And just to update you on the measures that we're taking on damp and mould following that tragic death in Rochdale of Awa Dijak. And we know that damp and mould problems encourage that growth of mold and mites, and that can really aggravate people with respiratory illness and people with asthma. So there are some really significant health implications for people who have a problem in their home. So we've set up a strategic compliance group, which I'm part of, and there's also an officer working group. And in both groups, we're working to sort of refine how we can best support residents. So not just in our own housing stock, but also in PRS and the private rented sector, and also, and Councillor Dedman will be interested in this, with our residents who live in Christchurch, who who are housed by Sovereign. And we're working very closely with Sovereign to ensure that those residents are supported as well. And you probably heard me, probably at Cabinet and Council, say that we're investing £500,000 in preventative measures into our own housing stock. We're also revisiting every sort of high risk case of damp and mould to make sure that the problem is fixed, and it's not just a sort of a tick box. We've had it reported, done something, and then never gone back and checked. So we're revisiting all of those as well. We've got a checklist coming out, which will be circulated to all councillors, and this is for. There's a couple of different checklists, but there's one for residents so that they are aware of what measures they can take to take responsibility for any issues that they might have in their property. But we've also got a checklist for officers or anyone who officially goes into a resident's home who might have a problem, so that we can make sure that they're asking the right questions. And so it would be things such as is there anybody with any vulnerabilities here? Checking to see if there are any sort of damp patches, the very obvious ones. Do you have condensation on the windows in the morning? So there's a whole list of things. So we're trying to make sure that people don't slip through the net, and that we do pick up any issues early on, and making sure that we put measures in, such as a fan in the bathroom to take away any possible condensation. We're signposting residents to support that's available to them. We're doing lots of training in our maintenance teams and in terms of damp and mould, and making sure that all those teams that go out and do that sort of responsive work are aware of what they should be looking for and what advice they should be offering our tenants and our residents. And we're looking at our response times for inspection and for action to make sure that the problem is sort of nipped in the bud and dealt with really quickly. So lots going on, lots of investment, and looking forward to you all receiving a copy of the sort of guidelines, which will be helpful if you do get residents get in touch with you who do have damp and mould issues in their property. And that's probably all I want to say at this stage. Thank you, Chair.
Thank you, Councillor Hampton. Has anybody got any questions for Karen? No? Oh, Councillor Butler.
Yes. Can I just ask you, say, a copy of the guidelines? Will that be a certain person that the resident or ourselves get in touch with for damp and mould?
Yeah, there should be a sort of a number, the best person to contact if there is an issue. Yeah, please don't send everything to me, which is what a lot of people seem to do at the moment. Please don't. Thanks.
Thank you. Councillor Kelly, would you like to present your report?
Thank you very much, Chairman. One thing really to bring to the board this evening, and that's one of the items that we had on the Health and Wellbeing Board week before last, which was really interesting and an inspirational presentation from Parks, actually, and from the Parks Foundation, and also Parks as a joint presentation. And it was to really set out the green space priorities and really emphasise the links between those green spaces and the use that our residents can and should make of them and their health and well-being. And I thought that might be of interest to members of the Health and Adult Social Care Board. So there. It was mainly about the priorities, as I say, and also to investigate opportunities for greater collaboration so that we can be sure that our spaces are working as hard as they can for our residents and also to support the public health objectives. So their priorities are about urban greening. They call it from grey to green, which I think is a rather lovely expression. They've got a strategy for a stronger impact that will be put into the new local plan when it emerges, probably next year. And evidencing the environmental justice, that's the mitigation of climate change. And then there's the Green Heart Parks that members might be aware of, which are currently funded until 2024-25. And they really want to extend that to include more green spaces to make it sustainable and also to look at social prescribing for nature opportunities. The third priority is the Stour Valley Park, which is the long, thin strip of land from Christchurch right down to from Hengistbury Head right up to Wimborne, through Christchurch and other parts of BCP and into Dorset. And that's all about improving the access, signposting, creating a gateway and to enable change to happen while they're there. So I have got a lovely set of slides that they brought to the meeting to show us, which really bring to life those things that I've described there. And I'm really happy, and so will Martin Whitchurch, I know, who brought them to the board. He'll be happy if I share them with you, Chairman, so that they can be sent out, or perhaps I'll send them to Louise, and then they can be sent out with the minutes, because I think the members might be interested to see those. Thank you.
Yes, thank you very much for that. Any questions, anybody? Councillor Devlin.
Well, can I just say to Councillor Kelly that yes, I totally embrace all the greenery. I think that's really brilliant. And I'm really glad that we're going with it, and very much keen to get that embraced by the planning committee, because I do know from previous times on planning committees that you can very much do a lot with landscaping. And for example, if people want to do burgling or antisocial behaviour, a prickly bush put in their way
Yeah,
is jolly handy,
absolutely.
and that has been proved. So I think that all these slides ought to go all round the council, not just to us.
Thank you, Councillor Dedman. Yes, I'm happy to do that.
Thank you both for your reports there. I don't think we've got any further questions. So we move on to the forward plan. There is a sort of basic forward plan there. I'm not sure it's our place at the moment to populate it with anything else, because there will be different people here for the next meeting, which is the 5th of June. But I think I will have to leave it to officers and whoever will be chair of the next committee as to what they're going to bring up on that one. Sorry, it's a bit vague, but I don't think it's my place to say what's sort of going on there. So, the next meeting will be the 5th of June. I just wanted to say a few words about our joint meeting with the Dorset Council and the South West Ambulance Trust, which some of you managed to attend with us. It's just very brief. It's taken quite a while to get this joint scrutiny with Dorset councillors, so we did look forward to this informal meeting with officers from the South West Ambulance Trust and the NHS. And a number of issues were discussed, and they'd been sent in beforehand, and I'll just go through what those questions and issues that we'd asked. Was the national and local context and data, the challenges and ways to overcome, lessons learned, key priorities, whether they'd receive financial investment, whether it is an equitable service across Dorset and BCP, recruitment and retention, communication with the public, the queues outside hospital, with the current information and how they manage those queues. And we had a very full and very frank discussion, and those committee members who couldn't attend but would like to listen to the recording, please ask Louise here for that to be sent to you. Okay, and so I'd like to sort of send my thanks to all those that attended, and to the South West Ambulance Trust and the NHS and to Democratic Services who sort of set it up, and I think I've mentioned our officers as well that were there. And it was suggested by Dorset councillors that they would like to have another joint scrutiny meeting, but that is to be decided later in the year. And they wanted it on the Integrated Care Board, and they felt that would be of value to both our councils, and they suggested that BCP then went to Dorchester for the next meeting there. So I will, before Councillor Evans sums up what we've been doing, I just want to say thanks to David Vitti, as we know has retired from his job as the Director of Adult Social Cares, and well done to Betty for picking up the reins there, and Phil. And I'd like to thank Joe O'Connell, who is leaving us for pastures new, I believe. Yeah, and over the last few years, I'd like to thank all the council officers, all the NHS, committee members, and also Louise Bate from Health Watch, and anybody I've missed, sort of all their input and bringing up some very interesting and some very, well, you know, difficult topics sometimes, but very, very important, considering how much of our budget is spent on adult social services. It's very important that this committee continues to have an overview and a scrutiny of these. And I would like, well, I'm not going to get, but it would be good if we could go back to having 6 meetings, because we have so much that we have to get through, and we're trying to squeeze it all into 5, and it's quite difficult with all the issues and topics and everything that are brought to us. So I'd like to go to Councillor Evans.
Oh, thank you, Chair. Okay, so I'd like to call this an ode to the Health and Adult Social Care Overview and Scrutiny Board. In 2019, our committee was began, We weren't sure what our purpose was, so turned to leader Jan. After much deliberation, our forward plan was made. Over time, we've had some members change, but most of us have stayed. We kicked off with the contentious clinical services review. We realised no one could say our name, so looked into that too. The hospital merger went ahead and UHD was created. We named us HOSC and ensured that all our purposes were stated. We've done our best to ensure that BCP's charges are aligned. Although we've had some complaints made, we've kept the compliments in mind. We've looked at safeguarding reports and made our caring better. We've followed all our statutory ONS duties to the letter. In 2020, a pandemic came which no one could foresee. Our care homes were all struggling, so we gave them PPE. The UK realised how valued carers really are. We need them more than ever now and should give them a gold star and better pay and more respect, support, training, career progression, travel allowance, etc. In 2020 at BCP, the administration changed. We elected a new chair for HOSC. Jackie Edwards is her name. COVID continued to cause us pain, but we started vaccinating and got people out of hospital before they're hibernating. We've kept an eye on the NHS from maternity to dementia. Our hospitals have built new wards and made a healthcare centre. We've looked at NHS 111 and access to GPs, but unfortunately we failed to solve the problems with dentistry. Healthwatch Dorset has helped us keep lived experience in mind. Their big plan has been published and improvements we should now find. We've improved our contact centre and day opportunities and sorted out our care home and extra care strategies. So, over the last 4 long years, what have we managed to do? Well, we've scrutinised the flip out of stuff and given some oversight too. Now it's time to say goodbye, but keep one thing in mind. The most important thing of all, remember to be kind. And I'd just like to echo, thank you. It's been a pleasure working with Jackie as our chair and working with you all. So thank you so much. And to the officers too. Thank you.
You need to send that round. Well, after that very good poem, which I think you should send round to everybody, I think we'd all like to keep a copy of that. I'd like to close this meeting and thank you all very much.